Hey, I'm Kasey Miranda. I'm a student physical therapist assistant at Jefferson State Community College, and I'm here to talk to y'all about ascites. So here's a picture of it's basically accumulation of fluid in your stomach. So if you go to the next slide. So what's the definition? It's an abnormal accumulation of fluid in the abdominal cavity. So the pathology and mechanism for ascites is that it's usually related to portal hypertension, like cirrhosis or congestive heart failure, and it's caused by other reasons like pancreatitis or malignancies. Many other things are often caused by ascites, like decompensated liver cirrhosis being the main cause, or heart failure, nephrotic syndrome, infection, abnormal malignancies, and malnutrition are some other causes. So there's many things that could cause ascites. So more about the mechanism, about like how it happens. So you've got like for cirrhosis and the result of portal hypertension, the high pressure in the vessels tries to pass blood through the cirrhotic liver, which causes vasodilation of the vessels to the stomach. So that decreases the filling of the vessels going to the kidney, making the renin system activate, causing sodium and water retention. And then excessive lymph fluid is produced and leaks into the tissues and abdominal cavity due to high pressure in the liver and vessels. So here's kind of like a breakdown with a chart that kind of makes it easier to understand. So some common diagnostic procedures. It's usually based on physical exam, medical history, blood tests, ultrasound, or CT scan to see the fluid. And paracentesis, which is a procedure where they get a needle inserted in your stomach wall after they do local anesthesia and get the fluid removed. So some age groups and lifespan changes. It's usually seen in older patients that have advanced liver disease or cirrhosis from excessive alcohol drinking, but it's possible for children and infants to be diagnosed with it also. And then usually ascites is a secondary symptom that is caused by an underlying factor like portal hypertension, malignancies, and liver cirrhosis. So the medical prognosis, it depends on the patient. So like depending on the underlying problems and like what is causing their ascites in their stomach. So like for like the prognosis for malignant ascites is poor, and then most cases have a mean survival time between 20 to 58 weeks depending on the type of malignancy. As shown by the group of investigators on a case I had in my paper. So the ascites due to cirrhosis usually is a sign of advanced liver disease and it usually has a fair prognosis. So here's a fact. Cirrhosis accounts for approximately 85% of cases of ascites in the U.S. The overall mortality for patients with cirrhosis and ascites is 50% at 2 years. But in Europe, it's 75% of cases of ascites are due to underlying cirrhosis. So what do you do to treat it? So for massive ascites, like if you're really distended, there's a large volume paracentesis is preferred and may be repeated periodically. So again, the paracentesis is whenever you get a needle basically and drawn out that fluid in your stomach. So another one is called a transjugular intrahepatic portosystematic shunt, also called TIPS for short. So that can be used in patients with refractory ascites needing frequent paracentesis. TIPS is the most recent treatment introduced for the management of portal hypertension. So some functional impairments, physical impairments, functional limitations, and disabilities. So usually some impairments for patients with ascites would be pain, swelling, limited range of motion due to that fluid buildup in their stomach if it's severe enough. And then other impairments can include decreased coordination and balance, decreased ability to do bed mobility, transfers, gait training, because you have a distended belly that could potentially just kind of like make you lack balance, and like you're not used to having that. So depending on how large it is can affect how greatly you would be limited. So patients can have also have function limited independence with activities of daily living, ADLs, like bending down to tie a shoe or picking up something, depending on the condition and severity. So the disability aspect of the patient that is diagnosed with ascites depends on whether the treatment or procedure worked. So if all the fluid was removed, then the patient would have no disability, because then they'd be able to go back to normal once they get all that straightened out. So if the ascites persists, then the patient may have chronic pain while standing or walking, limiting their social roles and activities, and may have to be in a wheelchair to accommodate. So how are these deficits addressed in physical therapy? So I just named a few. There's probably many others you could think of. So with to help with shortness of breath, some people may have, you can do breath techniques, breathing techniques. So like doing the in through your mouth, in through your nose, out through your mouth, the pursed lip breathing. And then to do like help with pain, you could do different modalities, just like a cold pack. And then you could do patient education with like bending and bed mobility, like let them have compensatory movements to help, like side bending instead of bending towards the front. And then range of motion exercises on whichever area is limited for that patient. So it could be their leg you can work on, or their arms. It just depends. And so positioning you could also do for swelling. And so I read research that the Fowler's position, where the head is elevated 18 to 20 inches above the knees, is the most comfortable for the patients. So, and then general strengthening exercises for the surrounding areas just to help them with ADLs. So, precautions and contradictions during therapy with this. There wasn't much info about this, but you definitely want to like check their vitals before and after the treatment just to make sure their respiratory isn't too slow or too fast, and blood pressure and heart rate is normal. And then watching if there is an increase in abdominal distension between sessions. If you notice if it's getting bigger or smaller, just watching for that. Because if it's getting bigger, you might want to call the doctor or nurse and let them know what's going on. So ascites, so it depends on what the underlying factors of the patient may have. So like they might have precautions if they have heart failure or cirrhosis or things like that. Every patient is different with this. So other information regarding the progression in this physical therapy treatments, until a medical treatment is done, like the paracentesis, where they draw out the fluid, or the TIPS, which is the shunt surgery, abdominal distension will continue to be a problem and limit the patient. And then progressing with addressing the pain, swelling, and strengthening will continue throughout the patient's therapy treatments. So until you get that medically, like the fluid taken out, you could have limitations until you decide to get it treated. So concluding, while living with ascites, individuals should weigh themselves daily, limit salt intake to reduce fluid in the body, even if the patient is taking diuretic medication. And then ascites is not something to procrastinate to going to the doctor to get examined, because it can be serious very fast and if it's not properly treated. So you definitely don't want to wait to go to the doctor.